Each year on World AIDS Day, the State Health Department gives an award to an individual who has made outstanding contributions to HIV/AIDS services in Hawaii. The award is named for Suzanne Richmond-Crum, who worked for many years creating and directing several important HIV/AIDS programs. This year, the award goes to Dr. David McEwen, who was the first physician in Hawaii to treat people with AIDS in the early days of the epidemic. He recognized that many people would need other support services, and that prevention of new infections was also important. He helped to found the Life Foundation in 1983, one of the first AIDS service organizations in the country. It's now known as the Hawaii Health and Harm Reduction Center. Life Foundation, HHHRC, was the first nonprofit agency to take prevention messages into the schools and established the first needle exchange program in the country. Thanks to the vision and dedication of Dr. McEwen to both his patients and the community, we can be grateful that Hawaii has fared better than many other places in the U.S. Congratulations to Dr. McEwen on this well-deserved award.
Congratulations, Dr. McEwen, on winning the Suzanne Richmond-Crum Award for 2020. Without you, we would be nowhere where we are in our low HIV rates, our responsiveness to the epidemic, and we're so grateful for all that you've done for people living with HIV.
Oh, Dr. McEwen, what can we say but congratulations. Enjoy your award and celebrate life.
Aloha, Dr. McEwen. Congratulations on the well-deserved Susan Richmond-Crum Award for 2020.
Aloha from the Big Island of Hawaii and happy World AIDS Day. My name is Peter Tui Silva at the Hawaii Island HIV/AIDS Foundation in Hilo. And I'd like to congratulate Dr. McEwen on the well-deserved Suzanne Crum Richmond Award for 2020. I got my start in this field because of you when I started at Life Foundation in the 1990s. Geez, I'm dating myself, but indeed, Life Foundation helped change my life and helped me change the lives of
Congratulations, Dr. McEwen. Good job, yay.
You know, it's really, I've been really fortunate to have people that I could rely on as far as the cause and the care of HIV. Dr. McEwen, without you, I don't know where Hawaii would be. I think we would have had a horrible time trying to figure out what to do and how to care for HIV, people that live with HIV. I want to thank you so much for all the things that you have done throughout the years. I mean, if it wasn't for you, we probably wouldn't have a Life Foundation, hence not have a Hawaii Health and Harm Reduction. So I want to thank you for all the things you've done. You are definitely one of these angels that live amongst us. You do the ultimate of what we perceive as God's work. You do the ultimate of that. So thank you so much, and congratulations on your Suzanne Richmond-Crum Award.
In 1981, people didn't have the diagnosis of AIDS because we didn't even have the word. But we started seeing people with swollen lymph glands and everything. And I sent one of my patients to UCSF Moffitt in San Francisco. And then a couple of months later went to meet a fellow there in Dr. Varsamis's lab by the name of Dr. Donald Abrams. And Donald took me upstairs to show my patient's lymph nodes under a microscope. And at that time he was doing research with the HTLV1 leukemia virus that occurred primarily in people from the Far East area, Japanese and other people primarily. And after a brief discussion and looking at the slides, he turned to me, and this is a moment that has remained in me for the rest of my life. He turned to me and very seriously said, I think this is an HTLV virus, also a T-cell virus, which means the virus attacks the T-cells. And I think it's very similar to the HTLV2 virus that he was working on. And he says, I can't, and the rest of us here can't get any money to prove it, but I predict that's going to be the cause, and that it is sexually transmitted, and it's a terminal illness. We don't have any treatment for it. And then he very kindly just turned to me and says, you know, take that information, and that's what you're going to have to deal with. And I didn't know it at the time, but it sounded extremely reasonable to me. And what I now know in retrospect is here in 1981, I was told by this friendly doctor, who's now a good friend of mine, what the cause of the virus, of the disease was. And so I immediately gathered up brochures from the San Francisco AIDS Foundation, which was in its formative days, and from Gay Men's Health Crisis in New York City, and asked permission to reproduce their information in the brochures. And they both agreed, saying just attribute it to us so that they can get their name out there a little bit more. So I gathered that information together, and with John Acevedo, who was working at the Department of Health in the STD department, doing counseling, and Bill Mintz, who worked with the Hawaii Credit Union, and then Bill Smith, who was an attorney, who, to the best of my knowledge, still works over on the Big Island. We sat down, the four of us together, and we agreed that we needed to create something. We decided, when I went through medical school in Canada, I had I call her my surrogate mother, who was Jewish, Yetta Gold, and often had dinners Friday and Sundays at her house. And as I went through medical school, it was really food helped to sustain me a lot. And we would often say l'chaim, which meant to life. At least that's the understanding that I had. And it's often done when you're celebrating for some reason and you have a drink or something. L'chaim. And I knew it meant to life, and I went, that's what we're all about, is saving lives. So let's call it the Life Foundation. And we all agreed. And we joked at the time because we figured a lot of the anti-abortion people might think that we were an anti-abortion organization. And I just laughed and I said, well, maybe they'll give us some money until they finally figure out what we are. And that actually happened. It wasn't a lot of money, a couple $100, until people figured out what we really were doing. And all of those four had resilience in them in terms of grasping the incredible big job that was coming. And this, again, that would be probably right about the beginning of '82. As the Life Foundation came together, an incredible group of resilient activists came together and wanted desperately to help. We got our 501c3 documents done, both for state and federal, and taxes, and we started fundraising. And we originally had two little houses in Waikiki that Bob Magoon, who was one of the co-owners, along with Jack Law, of the Hulas, was part of his family's property, and they gave us extremely cheap rent to become kind of the beginnings of a physical place for Life Foundation, where we could have clients come in and at group meetings, do outreach activism, and that's where it all kind of came together, and it was an incredible group of people. Sorry. That's just my asthma. And it was a very, very, very powerful experience to be with these people. The energy was amazing. It was productive. We had lots of disagreements and agreements, but we always would come up with a compromise. We had a board. We eventually started to be able to hire and employ one at a time, and put together in a team, and the support groups were just amazing. But again, at basically 82, 83, 84, 85, we didn't have testing to do, to see if people were really positive. All we had was people getting sick, arriving on our doorsteps, or calling a doctor's office and being sent to us because we got known in the community, which is what we wanted to do, as a place where we would comfortably deal with HIV. And we got very good at working with the legislature. We had volunteer attorneys that helped to rate proposals for intelligent law to prevent discrimination in healthcare, in dentistry care. Kirk Kashmir and David Brustein were two incredible people that helped put that together. Kirk was brilliant. I remember one time at a legislative meeting where we were testifying about something, Kirk would often write the proposals for the law. And we were in this meeting, and I was sitting next to two really prominent people who I knew would be potential opposition. They didn't really know who I was, so I could kind of innocently sit there, just kind of looking stupid. And I heard one of them say to the other one, "So what's in this and who wrote it?" And one of the guys said, "Oh, Kirk Kashmir wrote it." And the other guy said, this is one of our opponents, said, "Oh, we might as well pass it because he's so good at what he does, we won't survive any opposition." And I became to realize that even amongst people who opposed us, and there were lots, we usually won the legal battles because we had so many good volunteers in the legal area. These attorneys also would write wills and all sorts of legal documents for patients or clients for free. We had helped with the creation of the food basket, and we had lots of donations we would give out to people. We had marches. All of the volunteers, there's so much intermingling with the different organizations. There was not only Life Foundation, there was Gregory House, there was ACT UP, there was the Food Basket, and all of these different organizations. There was cross coverage between boards and between volunteers and stuff. And we became very, 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 very effective. And in fact, when it finally reached the point of the needle exchange program, which started at Life Foundation and then moved over because it was becoming so big and there was a lot of debatable controversy, moved over to Department of Health, and then in later years it moved back over to Life Foundation, and then it incorporated with Life Foundation and become Y Health and Harm Reduction Center. That's its new name, but I still affectionately use Life Foundation. The needle exchange program was amazing. And at roughly the same time, Life Foundation started an education program in the schools. We started at Punahou School, was willing to do it right away as soon as we had something going. Kristen Rustrak, a nurse here in town, put the program together, and I helped her, and we went and did the first presentation over there. It was so successful that Punahou kept asking Kristen to keep coming back. And then what happened is the Department of Health called us and asked if they could steal our kind of curriculum, and we said, of course, and we just gave them a copy, and the State Department of Health started doing it. We did lots of programs on them. I can remember doing a very, very, very large program with Tony Natoli out of the Kaneohe Marine Corps Air Station, and they just wanted the crew there to be educated. And when we went over there, we thought there would be maybe like a couple hundred people there. There were a couple thousand people. We were blown away. And the military had people there when we were there. They asked us one thing special: don't tell anyone you're doing this, because they wanted their people to know. But the military, under the control of President Reagan at the time, was basically in the closet about everything. And at the very beginning, and we're talking the beginning in the early 80s, the military was just part of the whole big political problem. So anyhow, we did military presentations, and then we did more. And then the thing that was really very touching for the board and the volunteers at Life Foundations, the people at the CDC, Oscar Curran, and I'm blocking on the other name right now, but they would come out here, and they saw that we had, when the first testing, the antibody test came out, Life Foundation, even though there was no treatment, we were intentionally been working on laws to protect people in case they should be positive. Those laws did get passed. And so we voted at the Life Foundation, and we were the first AIDS organization in the nation to encourage people to get tested. the simple principle is knowledge is power. The more you knew about yourself and what was going on, the more you could take wise steps. And that decision really was seriously influenced by Jack Law, who was on the board of directors at the time and who still runs Hula's. And Jack, when we were debating it, he, at one point, I can still remember him standing up, simply saying, "We will do what saves lives." And, you know, we don't care what anyone else says. In Hawaii, we're separate from everyone else by a big ocean. We can make our own decisions. We will save lives. So we passed it. So basically, we had the first aggressive in-state testing program being approved by the AIDS organization. We had education going on in the private and the public schools. We had a needle exchange program going on, and we had a major support service going on. So we were way ahead of a lot of other places in the nation. And I still remember Dr. Curran at the CDC and a couple of those other people. They would come out here all the time to see what the Department of Health and Life Foundation was doing. And they told us, they said, "We don't understand why you're successful, but keep doing it and we'll keep supporting you." And so behind the scenes, the CDC, you know, right at the very top, was basically supporting the Department of Health and the Life Foundation whenever they were doing innovative or new things and helping to keep alive the old things. And so I was always just very quietly proud of all the people at Life Foundation for all the amazing things and the amazing reputation that we developed nationally. And we had organizations around the country visiting Hawaii to see what we do and how we do it. And one of the other dynamics that was really important there was that the Department of Health and Life Foundation just decided, we're working together. Well, even though we had people protesting and various things, and we understood it, and people have a right to do that, we saw no value in protesting. And even when the Life Foundation decided to support testing, the Department of Health saying, "I'm not sure you should do that because blah, blah, blah," we went, "I'm sorry, we're supporting it." And I could still see their faces kind of smiling like, "Oh my gosh." So there was just, it's kind of weird, but it's kind of like there was enlightenment going on in Life Foundation all the time. There was activism, enlightenment, there was caring, there was love, there's compassion, there was leadership. So that's the foundation of the Life Foundation. And my hope and dream is that Hawaii Health and Harm Reduction Center will grasp into that story and carry it forward, recognizing that they are the next generation that are running it. The torch has been passed, and you have an amazing history. Know it, take it, and go with it, and keep doing cutting edge stuff. Because that's what being in Hawaii is all about. A lot of the good and the bad that's going on right now is so reflective of the good and the bad that was going on back there. And in the midst of it back then, there was a person, Dr. Suzanne Richmond-Crum, who I knew very, very well. And she had the charge from the Department of Health to create a program, that Hawaii State Seroprevalence Program. And she talked about how it was going to be a program that would help all people that were HIV positive and segue in the delivery of health care in the form of covering doctors' visits if they didn't have health care, covering their medications and if they didn't have health care, and covering their lab tests and everything. And it was quite new and controversial. I think it was the only one of its time in the country. Susan was profoundly committed to all of the people that had HIV. And she got to know all of the clients that were in Hawaii well. She often would visit them in our office place, but then she would also sometimes visit them at home. She would visit them in the hospital. And she was a real advocacy activist within the structure of the Department of Health to make sure that people were not abandoned in any way, and that efforts were extended to them, and she became one of the bright lights in the Department of Health in terms of compassionate care. Resilient is just part of her nature. She could withstand anything, be it critics within the infrastructure of the government, people that were ill, that were suffering, governments, legislation in the legislature. She was a tour de force, and it was a joy to work with her and to know her. And when she became very ill, she confided in me with all that was going on, and I grieved for a long time because I considered her, like a best friend. And so I'm profoundly honored to be given this award. And the other people that have received it over the years are all part of what I call a kind of a cherished group of people who have carried on the tradition of Suzanne's activism and commitment to delivering care, working within state departments of health or social work or all those different services. All of them have been amazing and wonderful people. So here we are, it is November 2020, basically 40 years of AIDS. And I think we're at an absolutely amazing point that it's hard to believe. I had hoped for a vaccine and a cure much before this, and it hasn't come. So that's been a profound, overwhelming thing for everyone. On the other hand, even though I'm now retired, I keep up with the New England Journal of Medicine. And a couple months back, and I still go to HIV doctor meetings here that we, from the Community Consortium of AIDS Physicians, we started many years ago. And even in the midst of COVID, there's still lots going on. And I remember at a recent meeting where we were talking about all the new drugs that are coming out to be able, be it used as a treatment or as in a prep manner, in other words, preventing people from getting the disease. There's new drugs that are coming out that are injectables, and they will not only be single drug injectables, but in some cases a mixture of more than one drug, as to help prevent people catching it and help people getting treatments. And these injectables right now, right this moment, we're talking about giving it to them once a month. Some of the other ones are looking at it once a week, once a month. They're looking at the studies are going on, looking at every 2 months, 3 months, 6 months. And there are a couple of them looking at a shot once a year. And that is very, very, very exciting because it makes treatment in terms of prevention, so much more feasible. And in terms of care, especially if people are not good at taking pills and remembering them, and lots of people have trouble doing that. If you just needed a shot once a year, and this shot would obviously have basically some medication there to allow slow release of medicine, so your blood levels will remain high throughout the whole year or 6 months, whatever it's going to be. It gives a whole new paradigm to how to deal with this illness, and it gives a whole new opportunity for Life Foundation, Hawaii Health and Harm Reduction Center, to advocate for people that are ill and for treatment and all stuff, and it'll really change how they're going to be doing the things that they do. That'll be really fascinating. I also read recently in the New England Journal of Medicine, there's an editorial from Dr. Fauci talking about where we're at. And of course, he's been a center of inspiration for the globe on HIV, and he's now a center of inspiration for COVID. And he is sending out lots of positive vision, and I'd certainly recommend the New England Journal of Medicine as a source for a lot of these articles. I remain, that's my nature, I'm eternally optimistic. I think we will get a cure. a treatment to cure people. Vaccine remains incredibly elusive. This virus, the HIV virus, is so different from a lot of the other viruses that we have vaccines for. And so it is indeed complex. I will choose to remain optimistic, but I really don't know about that. But Life Foundation's future will definitely change when these new treatments come in new and very important ways. And I'll leave it up to you folks out there who will be new volunteers at HHHRC, or new members of the board, or new volunteers for the organization, to kind of think through and guide where we're going to go in the future. But Life Foundation is going to be around for a long time, because fundamentally Life Foundation is about compassion, about love, about caring for people, and that will never go out of date.